One of the top questions that we get from customers when they're going to Medicare, they're turning 65, or maybe they're disabled for 2 or more years, whatever that looks like, they're going to Medicare, they're becoming eligible for Medicare, is how does Medicare cover dental, vision, and hearing? They want to know how Medicare covers dental, vision, and hearing. And that's a very fair question because dental, vision, and hearing can be some of the most expensive services that you run into, especially if you're looking at things like major dental claims such as bridges or dentures or crowns, root canals, whatever. Those can end up being a lot of money out of your own pocket. So in this video, for the next few moments, I'm going to share with you some facts about Medicare and dental, and then also how we can solve some of these things that we're going to talk about, how we can fill in some of these gaps with Medicare and dental. So this video is quite literally about dental coverage and Medicare, dental coverage and Medicare. Now, I do want you to understand that the 4 parts of Medicare are parts A, B, C, and D. Those are your 4 parts of Medicare. Part A being hospital, meaning that it covers everything that is inpatient. Anything that you get done in the hospital, skilled nursing facility, things of those nature that are your room and board. That's kind of how we look at it. It's room and board. And then we have Part B, which is outpatient, meaning that anything that's done outside of a hospital facility, anything medical, that's actually what it'll say on your card is medical, Part B medical. And so it's going to cover your things like doctor's appointments, specialty appointments, rehabs, therapies, services, surgeries, things like that, outpatient surgery rather. And so this is going to be your outpatient coverage. And then we have Part C. I'll pin that one, come back just a second. But we have Part D, which is prescription drug coverage. That's prescription drug coverage, meaning that you are going to be able to use this at the pharmacy to get your prescriptions, and the Medicare drug plan would pay its share. You would pay your share. So those are the 3 parts. If you were to elect to stay with original Medicare, those are the 3 parts you have. So A and B here make up original Medicare. When you get your red, white, and blue card in the mail, you get your red, white, and blue Medicare card in the mail, it will quite literally say Part A and Part B on the card, and it'll say A, hospital, B, medical. And those are the 2 coverages you have that make up your health insurance. And then if you were to stay on original Medicare, you would then need to purchase an additional drug plan, a Part D plan, in order to get drug coverage, because A and B is not going to cover prescription drugs, so you would have to purchase a drug plan. Now, if you stay in this scenario right here, you stay in this situation, you need to know that Medicare does not cover dental, vision, and hearing. So original Medicare does not cover traditional dental, vision, and hearing claims. So if you're somebody who wants to stay with original Medicare so that you can use your own doctors and you have to worry about networks or prior authorizations, you need to know that Medicare is not going to cover your drugs, so you have to purchase a drug plan. But for this video, what we're going to focus on is that Medicare, original Medicare, does not cover dental, vision, and hearing. So we're going to have to talk about a couple ways that you can get dental, vision, and hearing coverage if you were staying with original Medicare. Now, the 2 ways that I can get dental, vision, hearing coverage when I'm on original Medicare, or when I enroll into Medicare for the first time. What are the 2 ways that I can get dental, vision, hearing coverage? We're going to focus a lot on number 1 right here, which is a standalone dental plan, a standalone dental, vision, hearing plan. But another popular method or strategy to get dental, vision, hearing coverage is going to be option number 2, which is Medicare Advantage. Now, bear with me. I'm going to go back to the beginning of my presentation here. This would then put us where we're talking about Part C. Part C is Medicare Advantage. It's Medicare Advantage. And Medicare Advantage is going to restructure your Medicare to Medicare replacement plan, meaning that your primary health insurance, your primary Medicare coverage is now going to be through a private carrier rather than original Medicare. And now what's going to happen is this private carrier is going to give you additional benefits, things like dental, vision, and hearing. So these Medicare Advantage plans are very appealing and they're very attractive to beneficiaries because you can actually get dental, vision, hearing coverage at no extra cost, which is nice. But what you are going to trade in that situation is the ability to use your original Medicare. If you were to enroll into a Medicare Advantage plan to get your dental, vision, hearing coverage, you would then now be subject to what we call managed care. So these Medicare Advantage plans, that's what they are. They're managed care. What does managed care mean? Well, it means that now you would have doctor networks that you would have to stay within. And if your doctor does not take the plan, well, you could very much likely have to change doctors or have to pay out of pocket when you go to a doctor that's not in that network. You would also be subject to prior authorizations, meaning that the Medicare Advantage plan will determine whether or not they're going to approve a service or deny a service that you need medically or hospital or even dental, vision, hearing. They'll say that you have dental, vision, hearing coverage, but they can deny those claims too. So you would be subject to prior authorization. And then you would also be subject to what we call steps therapy, which is part of the prior authorization process, meaning that they're going to take their time, or not take their time, they're going to put you through a process of making sure that a service is needed. So if I need to go get a surgery done, they're going to require your doctor and you to go through a process of proving that some other service isn't needed to actually solve whatever condition or situation you're in medically. And so Medicare Advantage is an option to get dental, vision, hearing coverage, but you're going to trade off a lot of things. You're going to trade off a lot of things, and that is primarily the fact that you'll be now enrolled into a managed care plan that now will decide your health care for you rather than you and your doctor deciding your health care for you. So a lot of people that I talk to, a lot of beneficiaries they like to stick with original Medicare. They like to stick with original Medicare, and they like to purchase a standalone dental, vision, hearing plan. They like to purchase a standalone dental, vision, hearing plan. And in this situation, what is most commonly happening is that the customer, the beneficiary, is staying with original Medicare, they're getting a drug plan, and they're also purchasing a Medicare supplement plan, some kind of Medigap plan like Plan G, Plan F, Plan N, something like that. And they're going to have that as their secondary coverage, which is going to be phenomenal coverage. And again, it doesn't put you on a managed care plan like Medicare Advantage does. So you keep your original Medicare, get a Medicare supplement plan so that you don't have to pay a lot of the out-of-pocket costs that are associated with Medicare. And then they purchase a standalone dental, vision, hearing plan. And to be quite clear with you, Medicare doesn't cover dental, vision, hearing, so that means a Medicare supplement would also not cover dental, vision, and hearing. You would have to get a standalone dental, vision, hearing plan, or of course you could just self-pay all your dental, vision, hearing claims, but you don't want to do that. And so with the Medicare, original Medicare strategy, getting a standalone dental, vision, hearing plan, what is that going to look like? Well, we like to use carriers that are going to give you robust coverage that starts very quickly, if not immediately. One thing that you need to pay attention to when you're selecting a standalone dental, vision, hearing plan is you need to pay attention to your waiting periods. So going with a standalone plan is great. It's a great thing to do, and we have plenty of contracts with standalone dental, vision, hearing plans, dental carriers that will give you great coverage. And one thing that we're always telling our customers to look out for is waiting periods. Make sure you understand waiting periods. We're always telling our customers that, because the worst thing that can happen is you get on a standalone dental plan and you go to use it, you're ready to use your plan, and then all of a sudden you have a 12-month waiting period that you were not prepared for. You have a 12-month waiting period. And so what happens is you go to the dentist and you go to use your coverage and it doesn't cover anything because the coverage doesn't start for a year. And so we like to look at standalone dental plans that have immediate coverage for preventive, for basic, and for major. We like to look at those things. Number two, you need to understand exclusions. Exclusions. A lot of standalone plans for dental, vision, and hearing will have exclusions that you need to be prepared for. One common exclusion people aren't prepared for is implants. A lot of these standalone plans will not cover implants. They won't cover implants, and that means that you would have to pay for implants out of your pocket completely, even though you have insurance. So we like to get plans that have those types of coverages in there that make them very unique, including implants coverage. And so that's something you need to pay attention to when you're getting enrolled to a plan. Other exclusions are maybe they have exclusions on how much you can spend on vision or hearing. Maybe it's a dental plan primarily, and then the vision hearing portion gets very excluded because they give you a limit on what you can spend. So you want to pay attention to those things because you don't want to go to your eye doctor expecting to get a pair of glasses and it only pays $200 on your lenses and frames, and now you're out $600-700 because you weren't looking at the coverage. And so those are things that you need to pay attention to. Getting a standalone dental vision hearing plan is a great way to go, and we have plenty of these plans that will be great for you, but you need to pay attention to exactly what you're getting into. We need to pay attention to the waiting periods, you need to pay attention to exclusions, and then you need to make sure you're going with a brand name you can trust. A brand name you can trust. Dental vision hearing plans are where they are. We kind of look at them as like a return of investment thing. I spend this much in, I get this much out. And so I need to go with a carrier that I can trust to be around for a very long time. There are some plans out there that will promise you the world that, you know, maybe it's a little too good to be true. And if you don't recognize the name, then you definitely need to look into it. We like to use brand names that have been tried, true, and tested for many, many years. And the last thing that you really need to pay attention to is your max benefit. A lot of beneficiaries, when they enroll into a standalone dental vision hearing plan, they're not paying attention to their max benefit, and that's an annual benefit, meaning that you get on the plan and there's a max benefit or maximum benefit of, let's say, $3,000 for the year. Once that plan pays $3,000, well, now everything else is out of your pocket for the year. And so you need to make sure you're paying attention to that, because if your plan has a $3,000 max, that's all it's going to pay for the year. If it has a $1,000 max, that's all it's going to pay for the year. So you need to pay attention to these four things. I need to pay attention to the waiting periods. When does my coverage actually start? I need to pay attention to exclusions. What is included in my coverage? What's not included with my coverage? I need to make sure I'm going with the brand name I trust, and then I need to look at the max benefit. Make sure I understand what the actual maximum amount my coverage is going to pay in a year. These are the four things you need to pay attention to. And the good news is we have plenty of agents that are well versed in these standalone dental vision hearing plans. They're also well versed in Medicare supplements and Medicare Advantage, and we want to help you with your Medicare journey. It's not just selecting your Part A and B, it's so much more. There's so many gaps to Medicare that you need to consider. You need someone you can trust. You need an agent that knows what they're talking about and actually understands the levels of Medicare so that we can get the right coverage for you. Medicare is a journey. We're a compass. Let us be a part of this Medicare journey with you. If you want to talk to one of our agents today about getting this dental vision hearing coverage, getting your Medicare coverage, please follow the information in the description of the video below, and you can talk to one of our Medicare agents today who can help you and get you set up right away.